Hey guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, subscribe and follow the playlist from the beginning so you understand every concept thoroughly. This is part 16 of the Inpatient Coding Series, and today we will learn about the physical rehabilitation and diagnostic audiology section of the ICD-10-PCS. I'm Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for medical coding certifications. I am dual certified from both AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. At the end of this learning session, we will have a better understanding of coding from the physical rehabilitation and diagnostic audiology section of the ICD-10 PCS. These are the 7 characters in this section. The first character is the section itself. The second character is for the qualifier or the section qualifier. The third character is for the treatment type. Fourth character identifies the body system or the region where the procedure is performed. Fifth character provides the procedure type qualifier. Sixth character is for the equipment used. And the seventh character is the qualifier itself for additional information from this section. The physical rehab and diagnostic audiology section consists of around 1400 codes and classifies procedures by treatment or assessment, fitting, and caregiver training as such. These are the 17 sections in the PCS, and today we are talking about the physical rehab and diagnostic audiology. This section represents procedures related to physical therapy, occupational therapy, and speech language pathology procedures. Remember that osteopathic procedures and chiropractic procedures have a separate section for themselves in the ICD-10 PCS. Physical rehab and diagnostic audiology procedure codes have a first character value of F. The second character is to identify the section qualifier or whether the it's a rehab procedure or a diagnostic audiology procedure to be precise. The third character specifies the type of the procedure. The fourth character specifies the body region or system on which the procedure is performed. Fifth character uh, is a type qualifier that further specifies the procedure performed, such as providing therapy to improve range of motion or training the patient on bathing techniques, etc. That's for the fifth character. Sixth character specifies the type of equipment that is used to complete the procedure. And for the seventh character, you may not find specific equipment listed here, but then a broader category of equipment such as assistive, adaptive, or supportive devices is specified for the sixth character. But then the seventh character is not specified in this section, and seventh character is always none for this particular section as such. Now, talking specifically about the third character. The third character specifies the procedure type, and there are 14 different values for this character in this section. Now, these 14 character values can be classified into 4 basic types of procedures or basic types of rehab and diagnostic audiology procedures: assessments, caregiver training, fitting, and treatment. Now, assessment. So, assessment includes a determination of the patient's diagnosis or the need for treatment, planning for treatment, periodic assessments, and documentation related to these activities. Assessments are further classified into more than 100 different methods, types of methods. Majority of these focus on the faculties of hearing and speech, but others focus on various aspects of body function and on the patient's quality of life, such as muscle performance or neuromotor development and reintegration skills as such. This is for assessment for the third character value. Now, caregiver training, again for the third character value. Caregiver training involves educating the caregivers with the skills and knowledge that generally are required to interact and assist the patient. Caregiver training is divided into 18 broader subjects that are taught to help a caregiver provide proper care to the patient. So this is caregiver training, 18 different broader subjects. Now the third one for the third character again is fitting. Now fitting is used for a device designed to facilitate or support achievement of a higher level of function. The fifth character used in device fitting procedures describes the device being fitted rather than the method that is used to fit the device. Now, definitions of devices are located in the definitions portion of the PCS tables and also in the index under the section F. If you go to the section F, you'll find the definitions for the devices. And then talking about the third character again, the treatment. Now, treatment is defined as use of specific activities or methods to develop or improve or to restore the performance of necessary functions or to compensate for dysfunction and minimize the patient's debilitation as such. Now, treatment procedures include swallowing dysfunction exercises, bathing and showering techniques, wound management, gait training, and a lot of other activities related to rehabilitation. The type of treatment includes training as well as activities that actually restore the function. So, this is for the treatment. Now, this is an example of coding physical therapy for range of motion and mobility of the patient's right hip. This is from the physical rehab section as such. So the section value is F, which is physical rehab and diagnostic audiology. Then the section qualifier is rehabilitation 0. Then the type is motor treatment, or the treatment type is motor treatment. Body system or region is musculoskeletal system and lower back or lower extremity for the body part as such. Then the qualifier type is range of motion and joint mobility. The equipment used is none and the qualifier is none. So the code would be F07, L0, Z and Z. This is for the physical rehab or the physical therapy PCS code. Now this is the corresponding table, how it looks like. That shows the procedure for the physical therapy to the right here. So the key points to remember from this section. The third character defines 4 types of rehab procedures such as assessment, caregiver training, fitting, and treatment. The fifth character is a type qualifier that further specifies the type of procedure performed. And the sixth character specifies the equipment that is actually used to complete the procedure. If you do not have the ICD-10-PCS coding manual with you, you can always download the online version from the CMS link. I have provided the link in the description of the video as well, but this is the link where you can download it from. Thank you for watching, guys. Subscribe to the channel if you have not done that already and follow the series from the playlist for the complete set of videos. In the next set of videos, we will talk about the medical and surgical section, the root operations, and also the official guidelines for ICD-10 PCS. Thank you.